Hi everyone, I'm Femi Oke and you are in the stream. Healthcare workers around the world are bearing the brunt of the coronavirus outbreak, but many are not getting the support that they need. Are you one of them? Share your thoughts with us on our live YouTube chat or at ajstream on Twitter. Take a look at some of the social media, please. The hashtags COVID-19, healthcare heroes, flatten the curve. These are from healthcare workers from around the world, and they have been asking us to appreciate their work as they stand on the front lines of the coronavirus fight. Get me PPE, that's personal protective equipment. Flatten the curve. I said it worked for you. Please stay at home for us. In countries hard hit by COVID-19, doctors, nurses and other medical staff have been among the most likely to become infected with the coronavirus, and they are constantly in contact with infected patients but often lack protective equipment, and they're exhausted after working long shifts with few breaks.
I'm a critical care nurse. I've just finished 48 hours of work. I just wanted to get some stuff in for the next 48 hours. There's no fruit, there's no vegetables. I just don't know how I'm supposed to stay healthy. And nurse people and people are just stripping the shelves of basic foods. You just need to stop it. Because there's people like me that are going to be looking after you when you're at your lowest. And just stop it, please.
That was Dawn Bilborough, a British critical care nurse after a 48-hour shift. So how are healthcare workers around the world handling the coronavirus crisis? Joining us to discuss this is Dr. Antoni Torres. He is the senior consultant of the Respiratory and Intensive Care Unit at the University of Barcelona in Spain. Also with us, Dr. Noran Al-Agba, a paediatrician at Silverdale Pediatrics in Washington State, a coronavirus hotspot. And finally, we have Dr. Ahmed Chouage, an emergency room practitioner and journalist based in London. I should basically ask you, doctors, how are you doing? Dr. Ahmed, in London, on lockdown?
Well, as in, given the circumstances, I'm doing okay, but
Yeah.
we're trying to get through the chaos.
Noran, Dr. Noran.
The same. We're on lockdown now. The governor gave a shut-in order for the next 2 weeks, so we're just trying to help the people we can.
Sure. Dr. Antoni, in Barcelona, police are on the streets making sure people aren't congregating. How are you doing?
I'm okay, I'm doing well, but the situation is catastrophic, let's say, because as you know, Spain has a lot of infected patients and a lot of patients in the ICU. So,
Dr. Noran, this is a very stressful time for everybody pretty much around the world. But when you are literally treating or not knowing if your patients may well be infected, what is that like?
It's something I've never experienced before in 20 years of working. I'm literally on the front lines seeing sick patients every day. Often my clinic has been compared to kind of a light ER for children. We do almost everything except trauma here. So I just saw within the last hour a patient who could be infected, and I saw them in their car on full PPE that I then disinfected to recycle, which is something we've never had to do before. Normally we take off the PPE, throw it in the garbage and move on, but I'm literally rotating 4 masks over 4 days using the same mask in between and trying to sterilize it to the best of my ability in between. And again, this is for the safety of patients and the safety of the healthcare workers. And it's unprecedented times.
And you say PPE, and we all know now because we're showing all of our knowledge on social media, that's personal protective equipment. Dr. Ahmed, I can see some little lines on your head. Lean forward and tell us what those lines are. We see them.
Well, as in, this is like a break from my shift at work at the moment. So I've just come out of recess. So this is like the safety goggles I have to wear, and then there's a mask as well. But this is the goggles that we actually have to wear just to protect us. Because then people think it's just something that you can inhale, but it can go through, for example, from your eyes and things like that. And it's one of those diseases that you can't see, but you know it's there.
Does it hurt?
It's very dangerous.
Yeah, Dr. Antoni, go ahead.
No, you don't know if the patients are or the contacts are infected or not, because it's very silent. at the beginning is what it happened in here in Barcelona is that 4 weeks ago, we were not taking all the precautions. And of course, now we are taking all the precautions, but a lot of contacts come from 4 weeks ago.
Right. It's almost like the damage was done before we could even realize what was happening. It feels like coronavirus is like a Trojan horse. We've woken up to a whole new world, and this virus has snuck in overnight and is attacking everywhere that we can see.
Dr. Ahmed, what were you going to say? Go ahead.
I said, even now, even though the news has come out about coronavirus and the discussions have happened about it, why am I still seeing traffic on the streets? Why does it take me so long to get into work? Why are people still walking around as if it's a normal day? We're supposed to be on lockdown. It's just a matter. People need to start taking it seriously.
I completely agree. I think we're in the same boat.
Dr.
Okay, let me say something about this. We asked it here in Catalonia at least 10 days ago to close totally the country, totally. All the frontiers and all the people at home, and the government didn't do that because we depend on the central government. And I think in United Kingdom you did something like this because the message of Boris Johnson were really very strange. First he said that he was not going to close anything. Now he's closing, and this is really very bad. This variable opinion, these variable actuations.
Dr. Ahmed, I see.
For us,
go ahead, Ahmed, and then Dr. Noran.
For us, it's reached a stage where basically it's already spread so far. So closing things down now isn't going to make that much of a difference, considering the fact that almost everyone I see now is corona positive until proven otherwise. So we just assume that everyone has the disease. And some of these X-rays that I'm seeing, maybe 2 weeks ago, I would have said this is a severe infection. Now it's almost like a normal.
Do you know, that is chilling.
Despite the fact that the patient,
That is chilling that you said that.
It's a very scary thing for us to see.
Everyone
so there
you
are some
see,
oxygen
you're just
numbers.
assuming. Yeah. Oh my God.
There are some oxygen numbers where a few weeks ago, I would have really thought that this patient was sick and needed tubing immediately. We're now like, actually, let's hold off. So when I say tubing, that means to ventilate the patient.
Yeah, okay.
You're right, but seeing now what happened in China, we didn't learn from that, or we did not expect that this was so terrible. And what was happening in China was terrible. And the government would have acted before.
Dr. Noran, go ahead. What were you going to say?
Well, I am agreeing with both doctors. I mean, I think we were caught unaware. We should have probably paid attention more, understood more of what was going on in China. And again, so I'm in Seattle near the epicenter of the nursing home outbreak. And it sort of spread, I think, in the community, and we lost patients in hospitals before we even knew it was on our shores. And so I do have to say, our governor, we're handling it state to state, and I agree with Dr. Antony that consistency would have been key. Here in the States, Washington State really locked down pretty early. We didn't have a shut-in order, but we shut down the schools 2 weeks ago. Some of us really pushed hard to make sure that happened, and the governor really has tried to be as ahead of the game as he can. And I feel like that's why Washington State is a little bit, has slowed the spread more than New York, which is really starting to feel like they're overwhelmed.
What I am noticing about where you're taking this conversation is that you are talking about the populations, you're talking about your countries, you're not talking about yourself, but every single day, every moment, Dr. Ahmed, you're just taking a break from your shift, every moment you could possibly get infected. How do you deal with this with your family? Ahmed, you start.
Well, as in, firstly, I remember the first time I went to see a possible corona patient, and at the time it was nerve-wracking, but now it's almost like that's it. It's a given that what everyone you assume has corona. So you take the necessary precautions, but you almost forget that you're wearing it all, and you're out there to try to do your best. You're there, as in it kind of feels like, not to compare it to times of war, but for us, because this is an invisible thing, it feels like we are being thrown into the trenches. And for me, in terms of the family thing, like I've now had to move out and live in a hotel just because I'm so high risk. Like anything I've touched, no matter how much I've washed myself, or you don't know if you've got rid of everything completely. And I don't want to put my family or friends at risk.
Yeah, the only contact that I have is my wife. I'm not seeing my kids for a couple of weeks, and my mother, who is 92, for more than 3 weeks. I just phone her 3 times per day.
And I have 4 little children. My husband and I work together. He runs my office. So I think we're doing the best we can to wash ourselves before we go home, change our clothes. The moment we get home, take them off and put them in the laundry right away. It is a likely reality my children are going to get this. And I'm not sure, neither of us can move. We can't both move out of our homes. So we've prepped our kids. I prepped them a month ago and said, look, you are a low risk group. You are likely to get this, and we're going to do the best we can to avoid it. My mom is 76, and she also works in my office, and she's coming in the middle of the early morning when no one's here. She's in a back office. And she's going home early and then staying in her house. And my kids haven't seen her since this began about a couple of weeks ago.
All right, let's get back to...
I just want to add,
Dr. Hamid,
add to that.
Sure.
Basically, because of all this and the fact that, like, for example, I've had to move out and stay in a hotel, like, what we have to realize is that should we, because we are high risk of catching the virus, should we catch the virus and get infected and become unwell with it, nobody will be able to visit us. Family members aren't allowed to come into the hospital to come and visit us. And that is something that's very chilling. And some of the most difficult conversations that I have even with patients is when I'm telling them that their prognosis is quite bad and they may pass away from the disease, is that they want to see their loved ones, but it's not something that's going to be possible.
So I'm going to go to YouTube because your conversation, Dr. Antonio, if I may, just for a moment, because I want our people who are watching you on TV to be able to communicate with you as well. So Elizabeth Rainey says on YouTube, watching all of you doctors right now, how can we get clean equipment like masks to you? What factories can we use, and how do we make sure the virus doesn't get on the boxes used to ship them? Very practical question. Dr. Naran, I've been trawling your Twitter feed, so I know what one amazing person did. So I'm going to show that picture, which is basically somebody. You tell the story, and then I'll go to the picture. You go ahead.
Well, the newspaper gets delivered to my doorstep, and I opened my door, and there were 2 boxes of masks sitting on my doorstep. Yeah. And at the time, I didn't know who left them. Most people in this town, I was born and raised here. I practice in the town I grew up in, so they know where I live. Yeah. And I didn't know who sent them. I now know who did. They want to remain anonymous, but I'm so grateful. I'm still using those same masks in that picture.
It's like a fairy godmother or fairy godfather just dropped them on your doorstep. Amazing.
It is, and the donations have continued to come in, and now I am starting to figure out ways to get them to other doctors. There are retired dentists that today I've had 2 or 3 retired dentists bring in masks, gowns, gloves, whatever they have in storage or they had left over from when they retired. Yeah. People are really stepping up in this community, getting them to us, and I mean, we're just going to do the best we can to make sure that both the workers and the staff in my clinic, the hospitals, and the frontline workers in the ERs and in the ICUs have what they need. Hospitals are assigning 1 mask a day. They're rotating them. They're putting their names on them. I mean, we need factories to step up, especially in the United States. I'm assuming it's in Spain and the UK as well, but we need factories to start churning out some protective equipment because we're going to be in this for a couple of months at least.
Dr. Antonio, what's it like for you in Barcelona?
Yeah. What we did a couple of actions. Myself, personally, I have 2 Chinese fellows working in research with me, and they have a lot of contacts in China and with the Chinese population here in Barcelona, and we could collect a lot of masks that we gave to the hospital. And the second action is that we collected all the equipment from the research animal labs. A lot of them work with mechanically ventilated animals. So we gave all this equipment to the hospital. And the third action, I think, is important. One Catalonian citizen is making mechanical ventilators. And then they expect to have 300 at the end of this week.
That's extraordinary. It's amazing what you can do when you try. Dr. Ahmed, go ahead.
Yeah, I was just going to say, I think it's about time like the private healthcare industry in the UK steps up. We've got a lot of private hospitals around the UK that they step up and provide some of their equipment towards the public NHS that we have here, because they've made a lot of money from healthcare, but it's time that, in this pressing time, that it's shared with us.
All right, doctors, I want you to know how appreciated you are. So as people are watching this show on Twitter right now, you're getting salutations from around the world. Ahmed says, this is the period we need to come together to fight this deadly virus. We need to give our doctors maximum support to tackle the coronavirus. And then we have from Ethiopia, COVID-19 updates. Be strong, doctors. Appreciate you. One more here from Habhab. Doctors around the world, you are our heroes. We Ethiopians are with you. Inshallah, we will overcome. So that's God willing, we will overcome. I want to go to Boston, Massachusetts, which is not at breaking point quite yet. But this is Dr. Josie. She's anticipating breaking point. Let's have a look.
My fellow emergency medicine residents and I go to work every day with this feeling of impending sense of doom, because we know that although Boston hasn't been hit yet like many other places like New York have, we know it's only a matter of time before our system starts getting overwhelmed by the amount of critically ill patients.
Do you know what occurred to me? And look, Dr. Naran, you can start, and then we'll go around the rest of you doctors, is that we didn't seem prepared as a world for a global pandemic. We didn't seem to be ready, and we had a couple of dry runs almost, and some scares. But how come we're not ready?
Oh, that's a great question. I think this is just, I just think the rapidity that this disease spreads, and the fact that people can be asymptomatic, meaning with no symptoms, feeling well, and that they can spread it to other people. Again, no one wants to do that. That's one of my greatest fears. But again, it's this asymptomatic spread that I think has changed this, and the fact that it's spreading so quickly that we're overwhelming our system. And I think in a way we haven't seen for at least the United States since the 1918 flu pandemic. I mean, that's the closest thing to me. I mean, I suppose the bubonic plague, while worse, is still, spread rapidly.
Yeah.
So again, in our lifetime, we've never seen anything quite like this.
Dr. Antoni, go ahead. What are you going to say?
No, this is we didn't expect that. This rapid spread, this virulence, so many patients, young and older in the ICU, mechanical ventilated with ARDS. We didn't expect that. Looking at the books and reading, it looks like the 1918 so-called but bad called Spanish influenza.
Yeah.
Because it didn't start in Spain, really.
So, doctors, this is what we asked our online community. We asked them this on Twitter. Is there something you want to say to the doctors, nurses, and the healthcare workers around the world fighting the coronavirus? And just scoot down here. We got this message. This is for you, doctors, and for all of the doctors and healthcare workers and medical professionals around the world. And this is a message from one of our viewers.
To all the doctors, nurses, all the medical practitioners, we want to thank you. And I want to take this opportunity to say that you guys are the real heroes who don't really necessarily have to wear a cape. Thank you. In the world that we're fighting a common enemy who has no heart or remorse, you're out there being soldiers on the ground. I'm so proud of you, and I'm really grateful for you. Everyone stay at home because this.
So there's that gratitude. But Dr. Ahmed, I'm just wondering, what else can we do as the public? Because there's so many countries that are on lockdown right now. How can we help you? What do you need?
Well, we need that the people stay home. This is the main message. This is the main message.
Right.
Yeah.
Stay home.
I completely agree. I think the thing that everyone can do, and again, you don't need to be, there's nothing special about that other than stay home. If you need to go to the grocery store, you need to go to the pharmacy, send one person, one person from your family. try as much as you can to alter your life, because it's going to save healthcare workers' lives, and it's going to save the lives of elderly and those who are affected by this virus. And if we can slow the number of people that need ventilators and need extra respiratory support, then you can allow healthcare workers to take care of those who are coming in without having to make decisions like Italy is having to make right now.
Dr. Ahmed, go ahead.
I think we just also need to bust the myth that a lot of young people think that they're invincible. They think they go to the gym regularly and that they're, under the age of 40 and that they're all fit and active, that they're not going to get the disease and not going to be affected badly by it. But that's not the case. I'm seeing people younger than 30 who are frequent goers to the gym that are now needing to be tubed and ventilated and on support. So this myth that they think that they can go out and still enjoy their lives as normal is not true. They are going to be affected. And the thing is, we're getting so packed with patients now, people being on ventilators, that if anybody was to get infected now and in 2 weeks' time they fall sick, there's going to be no ventilators left. As in, that's the thing that people need to realize, that it's getting so busy. Just stay at home. You're not invincible. It can happen to you.
Dr. Naran, let me give this question to you. Yes, go ahead, Dr. Antoni, go ahead.
No, a very important thing that we need is that the industries can design and make mechanical ventilators as we are doing here in Catalonia, using the three-dimensional systems technology.
Right. Let me go to YouTube, and Dr. Naran, I'm going to ask you to pick up on this question here, and it is really a concern, and people watching this and very stressed as they do so. So on YouTube, we have Rena Rule. I'm at Sacramento, California. That's where I live. I'm a resident there. I'm quite worried. Our case count keeps rising and then tripling. Dr. Naran.
Well, I think, again, what I can say is it's going to keep going. And I think we need to prepare ourselves for that reality. We were caught unaware. Now we need to hunker down, and we really need to take this seriously. And that point about young people thinking they're invincible is so important for so many of the flus, influenza, H1N1, various things that we've seen even in the last 20, 30 years. It generally has either focused on the very young or the very old. This is really a terrifying situation where coronavirus is picking victims at random. So really, we do know the sickest patients are 20 and above, up to obviously 80 plus. But the point is, you could be healthy, you could be fit, you could have no medical problems, you can still end up on a ventilator for weeks. So I think we really need that message out to the public that this is going to keep rising if we do not make important changes and stay home. And we're seeing that in New York. I think the number of cases is exponentially climbing and the deaths are increasing as well. Whereas Washington, while the deaths are still increasing, we are kind of steady state or slowing a little bit. And again, we shut everything down a couple of weeks ago, and now we have a shut-in order. And I hope people are taking it seriously. That's the number one most important way to fight this invisible enemy.
All right, Dr. Ahmed, if I gave you just one word to describe how you're feeling right now, what would that one word be?
I guess overwhelmed.
Dr. Naran, describe how you're feeling right now.
I would say, overwhelmed was what was in my brain. And so it's the same. It's this massive feeling of like trying to get a drink of water out of a fire hose.
Whoa. Dr. Antoni, if you could describe how you're feeling right now in a single word, what would that be?
It is overwhelmed is the real word.
Yeah.
But very willing to fight.
Do you know that fight is what I've seen on social media with medical professionals taking to social media. You have the best posts, you have energy, and you have purpose behind your posts. I'm just looking at some of the medical professionals around the world who are showing off their battle scars, which are the masks, if they have them, if they're fortunate to have them, that they have put very tightly on their face so that they can actually go to work and do their job. Can't think of a better place to leave our conversation than with the healthcare professionals around the world and the public saluting them. Thanks for watching. See you next time.